The Africa Center for Health Policy, AceHP, is advising the government against substituting a robust infrastructure for the delivery of medical supplies with medical drones. Now, AceHP says the needed infrastructure for delivery of medical supplies has been non-existent, and we've brought stories to prove that for ages, a situation that continues to stifle efforts to make medical services and products available to all. The think tank raises concerns about availability of blood to be supplied by these drones and lack of consistent standardization and regulatory frameworks in the health sector. I've been joined by Ahmed Farhan. He's Executive Director for AceHP, and Douglas Edufokwo, who's joined me in studio. He's a Public Relations Officer of the Ghana Health Service. Welcome to the show, gentlemen. And I must mention that Ahmed Farhan is joining us via Skype. Let me start with you, Douglas. Were there any consultations prior to this decision of using drones for medical supplies?
Definitely. We wouldn't say we are coming out as Ghana Health Service, the Ministry of Health, as government, coming out with such a policy, a very cost-effective policy. And then we will say that we are going to do that without engaging stakeholders.
Okay.
As we speak now, the Civil Aviation, the National Ambulance Service, the Ministry of Health, the Ghana Health Service, and all other stakeholders have been duly engaged.
Okay, and I'm asking that because there's some controversy in Parliament over this, and Deputy Speaker of Parliament, Joe Sewusu, has asked the Health Committee to take a second look at the drone for distribution of medical supplies agreement before the House can go ahead with approval. The committee has recommended that the House approves the deal, but approval was suspended after protest by the minority. Now, the minority claims the deal has been inflated by more than 600%, a claim that the majority denies, and they also add, that's the minority, that the Civil Aviation Authority has not given approval for the deployment of the drones. Mr. Osewusu wants the committee to amend its report on the agreement before the House can look at it. All right. Let me go to Ahmed Farhan. He is with the Africa Center for Health Policy, and they released a statement cautioning government not to substitute building or developing a robust medical supply system for the use of drones. Thank you so much for joining us this morning, Mr. Farhan.
Thank you very much. And good morning to your viewers.
Good morning. Great to have you. Now, you raised a lot of concerns about this new technology that government is trying to introduce. What exactly is your trouble with that?
First of all, let me state that using ICT, or if you like, technology devices to improve health isn't a problem at all. In fact, we at the Africa Center for Health Policy welcome such innovations, and I understand clearly the mandates of the Director General for the Ghana Health Service. And he clearly indicated that he wants to use ICT to achieve universal healthcare coverage. But using drones at this particular movement raises some questions, and that is what we seek to address. The drones specifically are to carry blood, as they tell us, and other medical supplies to skin. In the first place, whether we have blood available at our blood banks, we don't have them. If we have, it's always in a short form. And also, the requisite personnel at the hinterland that will transfuse the clients or the patients when the blood is delivered, they are not there. Even if they are there, they are not mandated to transfuse patients with blood at chip compounds, because we don't have chip compounds at hinterland. Sorry, we don't have regional hospitals or district hospitals at hinterlands. We only have chip compounds. And the mandate of chip compounds is not as compared to the district or regional hospital. So anybody or any healthcare personnel at chip compounds cannot prescribe or request for somebody to transfuse. In fact, you yourself cannot transfuse that person.
Ahmed,
It's
Ahmed,
not within your mind.
let me just have you hold on there and pick reactions from the PRO of the Ghana Health Service. He's raising some serious concerns there. One, and we know, as the story has always been, that we do not have enough blood in our blood banks. Even right here in the capital, in Accra, you go to regional hospitals, you go to the teaching hospital, which is supposed to be a tertiary level hospital, that's a Kolebu teaching hospital, and you don't even have blood. So he's asking a big question. You're putting the infrastructure, the technology together to transport what? Where are you going to get the blood from? As it is now, we are told that voluntary blood donation in Ghana stands at 36%, woefully inadequate. So what exactly are you going to be transporting?
Benis, you see, at times before we speak to health issues, we have to really understand the health system. You see, the health system has 6 building blocks that you have to improve if you are really intending to strengthen the health system of every country. We have challenges. Every health system has challenges. The challenges regarding unavailability of blood in some health facilities have some reasons. The major reason is the procurement of the fridges. Okay. We have varieties of fridges that preserve or store the blood plasma. Some have even the platelet storage compartment. And in terms of the fresh blood plasma, it requires a fridge that can keep it within negative 30 degrees Celsius at that temperature. Okay. The platelets do the same thing, negative 25 degrees Celsius. And these are very costly devices or equipment. You check online, you have some about $25,000 to $35,000. So we are saying that, yes, we have issues, but with this implementation, we are not just going to stand there. It means that we are going to mobilize these sites. We are going to engage in social mobilization to ensure that we have increase in number regarding the donors.
But we've been doing this for a very long time. So aren't we putting the cart before the horse?
No, I think this particular one, and let me clarify, it seems the public has the ideology that it's only blood that the drones are going to deliver. Okay. No, aside the blood, the drone is going to distribute about 48 products, including the vaccines and the likes. We have some communities, you go there and then you see that somebody will have even a snake bites. And because there's stock out is a major issue at some of the levels of the healthcare system. And you can't say because of this and that, you're allowing the person to die.
We'll come back to the issue of emergency services, because we also know that there's a big problem there when it comes to our health sector here in Ghana. And you're saying a snake bite, and that's an emergency service.
Yes, exactly.
Currently, as it stands now, we know the ambulance issue, we know the beds issue. I'll come back to you shortly. But Mr. Farhan, can you kindly share with us what your alternative to the drones in healthcare delivery is? What alternatives do you want government to look at?
Okay, here is the case. Listening to Mr. Douglas, he tried to say that the drones are cost-effective ways of improving our healthcare delivery. But we are saying that no, considering the price of the drones, how much it is costing Ghanaians, and then the alternative that we have. One, we are saying that even if you are going to acquire such a device, the alternative should be the Robinson R22 utility helicopter. That comes at a maximum price of about $270,000. You can check it. Let's compare that with the drones that is costing us about $24 million. Now, if we are not going to acquire such a device, traditionally, what we are supposed to do is that he was talking about the infrastructure, the equipment. The fridges are there. But even if he's saying the fridges are not there, why not buy the fridges and stock the various facilities that we have? In that case, we wouldn't need to buy any drone. The vaccines that he's talking about, we already have a cold chain management system that carries vaccines from the production unit to the end user. They're always available.
All right, so
they're telling us that they have to procure this zipline drone on a sole sourcing procurement method. What is the agency that is attached to it that we have to pass it through sole sourcing?
All right, Ahmed, let me just have you hold on there.
That the cost effectiveness of the.
Your alternative is clear. You believe that a helicopter, which comes at a cheaper cost, is something government should look at. But over the time, having this discussion and debate, the Rwandan example has been cited. On the line is Thierry Gatete Nyiringambo. He is a researcher in Rwanda. He joins us on the line. Thank you so much, Thierry, for your time.
Thank you very much for having me.
Great to have you. Now, first of all, help us understand, at what point did Rwanda decide to introduce the use of drones for medical supplies?
Right, so drones, I had the not saying that helicopters would be cheaper. Drones are probably 1,000 times cheaper than helicopters. So drones do not consume fuel, which is first of all, a green initiative, so they use electricity. It's like most of the GDP country.
Hello, Thierry. Sorry to cutting. It's really difficult hearing you. Can you kindly speak up?
Yes, I'm speaking up.
Okay, great.
I'm saying that drones are cheap, and number one. And number two, they do not use fuel. They use electricity, so they are also environmental. But it's a very hilly country, and some roads in the rural areas are not easy to practice. And drones are fast, so they are very practical to deliver. Some of the medical supplies include blood.
Apologies, it's difficult hearing Thierry. We'll try and re-establish a better line with him. But you had a quick reaction to what Mr. Farhan was saying.
Benis, I wish you could give me more time, because he needs so many responses that I think we have to clarify. I think the think tank are getting things wrong. They are not having accurate information, and I'll give it to them. Okay. Number one, we are not procuring any drone. We are just going to pay for the services. Okay. Number two.
But it's going to come at a certain cost.
Yes,
which the minority says is bloated.
Benis are coming. I'll come to that. I'll have to clarify that as well. Benis, number two. This sole sourcing issue he's talking about, he should give me an alternative. The whole world, he should do his research. The think tanks should do their research work very well and come out with a company with very good records in terms of medical supplies through flights. Zipline is the only company. And so for next year, United Kingdom is starting. Rwanda has started. Malawi, Ethiopia has also started. So what is he talking about? Number two, he's talking of HR systems that human resources are not available to even do it. This is where we talk of the capacity building of the staff we have available. We have midwives available, and now we are trying to strengthen and put in measures to ensure equity distribution of staff. So it's a call for review of HR resources and also their job description, which is ongoing at the moment.
So you're telling us here now that as you develop or seek to introduce this drone system into Ghana's health service, you're doing some reviews across the board, generally. That's what you're saying.
Exactly. Things are going on. Measures are going to put in place, and we have started already. And aside that, he spoke of you spoke of the minority issue that the cost is bloated. You sit as a member of parliament, and you have a contract with you. You don't study it well, and you come out to throw misinformation. You come out with misinformation to the public that you are using $88,000 to calculate for your cost. No, this is cost effective and it's performance-based contracts that we have signed.
Okay.
And don't forget that if the zipline company is not able to deliver, is not able to make more than up to 15 deliveries, that's less than 15 deliveries, we as a country are not going to pay a dime. We are not going to pay a penny to the company. We are not going to do that.
All right. We have Thierry Gatete back on the line. He's a researcher in Rwanda. Hello. Great to have you. Hope the line is better now. So initially you were great. Initially, you were telling us about why Rwanda decided to introduce the use of drones. It's been some time now. How is it catching on? Is it doing well?
It's doing excellent. Actually, so there are so many attributes to drones. Number one, drones do not use fuel. Can you hear me now better?
Perfectly.
All right. So they do not use fuel. So they use electricity. So they're environmental friendly. That's number one. Number two, Rwanda is a very hilly country. And some of the medical supplies that drones deliver are critical to medicine, to people within matters of minutes. So, for example, blood, they deliver blood mainly. And blood is something that you need within a matter of minutes. If you don't have it, you might die. And drones are very prompt to deliver them in every direction. There's a hotline that you call, and then within a matter of minutes, you have your blood thrown onto you immediately. Number two, they are very cheap. They are cost effective. The installation, so the whole facility is not expensive because this drone is not really. You do not need to install a big apparatus, technical apparatus. You have drones like the ones that are used for private use to film things or to photograph landscapes and so on. This is the same type of arrangement that these drones use. So it's very cost effective. If you wanted to send a car, for instance, within 100 miles to deliver blood in practical road, to take 3, 4, 5 hours. But with a drone, it takes a few minutes, 20, 25 minutes. So this is very effective, and it's been saving lives, actually.
Okay. We are told that at the time you introduced this, you had some high ratings from the Africa Society of Blood Transfusion. And so we understand that at the time that drone technology was being introduced, Rwanda had quite a good health or blood transfusion system. Is that the case?
It is the case. So basically what they were trying to say is that Rwanda is... people are encouraged to donate blood, and we have many blood banks within several areas. But that's what the ranking was saying. And then, so what we want is to connect the dots, to take the blood that is in the blood bank.
So that's it. So there were no issues of people walking into hospitals and not having access to blood or having to pay because it was in short supply.
No. Rwandans have a day of donating blood. We have a spot. In Rwanda we have these routine events, like once a month we come out to clean the city. And then on that day, in addition to cleaning the city, we have a car-free day, we have a city cleaning day, and we have a blood donating day every month. So as a result, we have sufficient blood banks in several places. However, we're talking about big hospitals. We have health centers that are very remote. That do not have the appropriate cooling system, the appropriate, system to preserve this blood.
Okay.
Blood remains in blood bank.
Thank you.
These drones have been linking the health centers and the blood bank.
Thank you so much for your time. Thierry Gatete Nyirigabo is a researcher in Rwanda, sharing with us the Rwandan story and obviously telling us the foundation for which they started distributing blood. You were talking earlier about or responding to claims by the minority in parliament that project is bloated. But let's talk about other concerns. Fly Zipline, the company contracted to deliver blood and other medical supplies using drones, has allayed fears or is allaying fears of Ghanaians and the minority in parliament. The minority was concerned the $12.5 million project could become a white elephant due to the lack of internet services. Speaking on Upfront with Raymond Akwa, country director of Fly Zipline, Daniel Amwa, said the company's system has been designed to work without internet services.
Every machine has the probability of functioning optimally, but because it's an unmanned plane, we adhere to very high aviation standards. So the drones have a lot of safety features that are built in. So for instance, if the drone, for any reason, in a very rare occasion, realizes that it is maybe moved out of parts or it's detected a malfunction, it deploys a safety panel. Yeah. The drones fly by 3 main means, okay? So we map a flight route. If you remember, I told you that we would go to the facility and take a geo coordinate.
Okay.
So once we take a geo coordinate, in consultation with the regulators, civil aviation, we map a flight route.
Okay.
And this flight route is then programmed into the drone. So once the drone sets off, it actually knows where it is going.
Okay.
So it doesn't necessarily need internet in Tumu or wherever to be able to know that it's going in this direction. It is mapped to know exactly where it is going. It will make the trip and then return safely.
So if you're one of those who had doubts about how this system will work without internet service in rural areas, well, you have your answer there. Let me quickly take your final words. We're running out of time quickly here. So you are telling the Ghanaian people that we were really being sincere to ourselves. We really need the service at this time when we have issues with ambulances, we have issues with beds, we have issues with even availability of blood, and also emergency service response, which is also another topic altogether. Are we being sincere with ourselves? Do we really need this at this time?
Benis, yes, we do. We do, because when you are improving your health system blocks, building blocks, you have to improve all at the same time. You prioritize, indeed, but the ambulance issue has been handled by the Ministry of Health, who, I think the minister came out and said next year we are hopeful that we'll get something. So we are gradually improving and then trying to solve all the issues. But let me state it clearly that the drone, we are not buying it. And if the company, Zipline company, distributes less than or make less than 50 deliveries, 15 deliveries, we are not going to pay anything.
Okay.
If the company...
That is 15 deliveries to a particular...
per distribution center.
Okay.
Because we have 4 distribution centers.
Okay.
If they make more than 15 deliveries, that's when we are paying $11,000. So it's not like we are paying, it's fixed. It's performance based. They are going to be paid based on their performance. And let me end. You see, this is our country. Our health should be our concern. So some of these issues, we shouldn't politicize it.
Okay.
Let's think as neutrals, let's think as Ghanaians, let's think of our mothers, our innocent women who are in labor in the villages, in the hard-to-reach areas, who, in terms of emergency, when they're stuck out of blood medicine, they can't access and they lose their lives. As you speak, about 30% of mothers who die in labor are people it's true bleeding.
And they can't access because there's no blood or there's no way to transport the blood to
At
them.
times they're stuck out.
Okay, let me pick your final words, Ahmed Farhan. He's with the Africa's Center for Health Policy. You've heard what Mr. Edu Fokwo has to say. What will your final words be to those who have to make this decision, whether or not to approve the deal?
I think that my brother in the studio is misleading Ghanaians. I have in my hands here a letter to Cabinet, and it is titled this, if you permit me, request for approval to use the sole source procurement method for the drone delivery system by Zipline International.
Okay,
for the delivery of blood supplies and medical supplies.
Ahmed, I think we've gone beyond that.
It comes at a cost.
He does mention that it comes at a cost, but he's justified why sole sourcing was the option, because according to him,
he just told us we're not going to pay. We're not buying the drones.
Okay. Yes, he says we are paying for the service, and he's given us details for that. But you have the opportunity now. Those who have to make the decision are listening. What would you want to tell them with regards to whether or not to approve this deal? Shortly, please.
For now, we believe that the deal should not be approved. Whatever money we have, we should use that to enhance the capacity of the health workers that we have, so that they can transfuse blood at a decentralized level. Let us open up our system. We shouldn't say that somebody has to be transferred or referred from the lower level to the upper level before they can get access to blood services. It is humanism. Thank
you very much. Ahmed Farhan is Executive Director, for the Africa Center for Health Policy. We lost him then in the latter part. And we've been having a discussion about this drone for medical supplies deal that government hopes to sign with Zipline. We've heard from almost all angles, brought you the Rwandan perspective as well. And we also had the PRO from the Ghana Health Service, Douglas Edu Fokwo, with us in studio. Quickly, you want to say something?
Yeah, exactly. And let me add that if we are able to pay the money every month, we are going to have 11,000 discounts every month. 11,000 discounts.
11,000 CD dollars?
Dollars.
Okay.
If you're able to make timely payments.
All right. Thank you very much for joining us, and well, there you have it. I'm sure the conversation will continue on different platforms, also for you in your homes, and we see what Parliament decides to do with this project.